A urogynecologist is a specialist who focuses on the care of women with pelvic floor disorders. The pelvic floor is the group of muscles, ligaments, and connective tissue in the lower part of the pelvis that supports the bladder, uterus, and rectum. When these structures are weakened or injured, women can experience a variety of problems that affect their quality of life. Here's a simple explanation of the role of a urogynecologist. 1. Pelvic organ prolapse. This condition occurs when the pelvic organs, like the bladder, uterus, or rectum, drop from their normal position due to weakened pelvic floor muscles. A urogynecologist helps manage and treat this condition, which may include non-surgical treatments like pelvic exercises or surgical options if needed. 2. Urinary incontinence. Urinary incontinence is when a woman has difficulty controlling her bladder, leading to leaks. Urogynecologists are experts in diagnosing and treating this condition, which can range from lifestyle changes and physical therapy to medications and surgeries. 3. Overactive bladder. Overactive bladder is a condition where women feel a sudden urge to urinate, often resulting in frequent trips to the bathroom. A urogynecologist helps manage this condition with treatments that may include behavioral therapies, medications, or sometimes surgery. 4. Fecal incontinence. This is the inability to control bowel movements, leading to accidental stool leakage. Urogynecologists help in diagnosing the cause and offering treatments like dietary changes, pelvic floor exercises, or surgery if needed. 5. Chronic pelvic pain. Some women experience ongoing pain in the lower abdomen or pelvis. A urogynecologist helps identify the cause of the pain, which may be related to the pelvic floor, and provides treatments to relieve discomfort. 6. Recurrent urinary tract infections, UTIs. Women who suffer from frequent UTIs may see a urogynecologist to explore underlying causes and receive specialized treatment to prevent future infections. Professor Zahid Mahmood, as a leading urogynecologist at Hameed Latif Hospital in Lahore, is highly skilled in diagnosing and treating these conditions. She uses her expertise to help women regain control over their pelvic health, improve their quality of life, and restore confidence in their daily activities.